Hi, this is Veronica Hodges, your coding instructor. I hope that everybody is getting acclimated to evaluation and management. I'm sure that you have several questions. I'm just going to do an overview this time, and I will send a detailed video as well with E&M. So, what are evaluation and management codes? They're codes that are commonly used by physicians of all specialties, and they were used are designed to accurately and consistently report levels of encounters. So, for right now, I'm not going to focus on everything, all of the components as it pertains to E&M, but just some of them to kind of get you familiarized with the material. Now, some of the components that I will not talk about today will be counseling and the coordination of care and time, but I want to talk about the other components of an E&M code. So you have your chief complaint, HPI, which is your history of present illness, review of systems, past family social history, physical examination, and medical decision making. And I just want you to know that the HPI, review of systems, and past family social history are all components of history. Then you have the physical examination, which is within itself, and medical decision making. And then chief complaint, um, of course, is what it is. It's the reason for the visit and should be documented in the note and can be documented by the nurse or the medical assistant. Now let's talk about history. Remember, for history, you have the HPI, review of systems, and past family social history. They're all parts of the history. So the HPI is a component of history, of course, and it consists of information described by the patient about their condition. Now, the elements of HPI includes location, severity, timing, modifying factors, quality, duration, context, and associated signs and symptoms. You may ask yourself, well, how does that work? That's a lot. Well, if a patient comes in the office with chest pain that's been going on for 3 days and that they decided to take, let's say, aspirin to alleviate the pain, well, the chest pain, of course, will be categorized as location. The time, 3 days, will be categorized as duration, and the fact that the patient has taken medication to modify the symptoms, those are modifying factors. So here again, HPI, of course, describes or characterizes what the patient comes in for, and each element is different. Just make sure you familiarize yourself with the information in your textbook as it pertains to HPI, history of present illness. Now, review of systems is an inventory of a patient's signs and symptoms. Usually, the physician obtains a review of systems by asking questions. Sometimes you may see the review of systems on a history form while you're completing your new patient information or your established patient information. There's asking questions about certain systems as it pertains to the review of systems. Here are the list of review systems, just like the one that's in your textbook. So just familiarize yourself with the list of review systems. And here again, the physician usually takes this information, but it may be on a history form. Either way, this information should be documented so that you can determine the correct level of service as it pertains to E&M code selection. And the final component of history is past family social history, and it's just what it is. Your past history is usually recorded, your family history is usually recorded, and your social history is usually recorded in your chart. So those are the parts of history, HPI, review of systems, and past family social history. And then you have your physical examination. You have a 1995 and 1997 body systems versus body areas or body elements. And here are your body areas and organ systems listed here, just as it is in your textbook. And remember that medical decision making, of course, is the last component of an E&M code, and medical decision making is the same for each E&M code. The parts of medical decision making, or the components of the medical decision making, consist of number of diagnoses and or treatment options, or diagnoses and or treatment options, amount and complexity of data, and of course your risk. And usually the table of risk is used for the C3 component. And like I said, we'll talk more in detail about the E&M codes and selection shortly. If you have any questions, feel free to contact me via phone or email. Thanks.